Aloha, welcome back to Hi Now Daily. 2026 is all about a new year, new you. And for a lot of people, that means focusing on weight loss. And beyond diet and exercise, some folks are turning to GLP-1 medications. And we have Dr. Marie Williams with us and Dr. Graeme Reed from Ali'i Nani Aesthetic Medicine to break it all down. Thank you for coming in.
Thank you for having us.
Okay, Dr. Reed, I want to start with you. GLP-1, what is it and what does it exactly do?
So GLP-1, technically it's a GLP-1 agonist, which means it stimulates certain cells around the body. It works on cells in the brain, in the area of the areas that control appetite. So it stimulates those to make you feel as if you don't need to eat as much, make you feel as if you're full already. And so that reduces your appetite. It works on cells in the gastrointestinal tract, slowing down the transition of food. So you eat, your stomach fills up, and you feel full. And you stay feeling full for quite a while. And it also works on cells in the pancreas that control sugar levels in the blood.
Wow.
And so it balances your sugar levels, it makes you feel satisfied for longer on less food, and it reduces your appetite.
We love reducing those cravings. We get it all the time here on Hi Now Daily. But Dr. Williams, I want to talk about the effects on your body, but specifically on your face. So when you have that drastic weight loss, right, there's certain things that we don't think about.
Great question, but first let's qualify that GLP-1 medications do not directly cause all this aging that you see with the weight loss. It is a result of a rapid weight loss to most patients, so think of it, and this is how I frame it to my patients. We like what's happening in our body.
Right.
Unfortunately, it does show in your face because we have the good fat, the facial fat. So think of the facial fat as the one that provides support for the skin. And what happens when you lose that support? Now your skin becomes more lax, you're seeing more wrinkles, you're losing that nice definition and contour that you have, and then you have that gaunt and hollowed and aged look that happens to patients that are on weight loss but don't know what to do with what's happening on their faces.
Interesting, interesting. That's something I guess we don't really expect because we're just focusing on the weight loss, but sometimes that's kind of what happens after the fact. So Dr. Reed, what can we do to kind of combat that contouring, that aging of the face?
So there's a lot of things that we can do, and we've been in Ali'i Nani, we've been in business now for 10 years. 10-year anniversary coming up, I guess, in May.
Congratulations.
Yes.
So Marie and the team have got a lot of experience in this whole area. And that's one of the things we like to work with the patients. We don't just give them the medicine and say, go ahead and use it. We have them come back and we talk to them.
Wow, look at those results.
Exactly.
So I think Marie can probably, or Dr. Williams can explain a little bit better about some of the things that we offer.
Yeah, I mean, Dr. Williams, I just want to ask you, it's very important to find a provider that's going to guide your weight, but then and your aesthetics, right? So that's what you do at Ali'i Nani. I mean, we're definitely seeing it right there.
Yes, you can see all these glow-ups of our real patients, yeah? So what is unique with Ali'i Nani Aesthetic Medicine is because we have the expertise both on sustainable and healthy weight loss, as well as the aesthetic side. So depending on the concerns of the patients, I've mentioned about the laxity and all that, we combine treatments. So say, for example, during your assessment, then you're losing the nice definition and contour. We could do dermal fillers. We're talking about laxity. We could do biostimulators. You're seeing more wrinkles now. We have neuromodulators. So meaning to say, all these things, there's a solution. You just have to go to a place that exactly knows what they're doing, and this is where Ali'i Nani Aesthetic Medicine
And that's you guys, 10 years running strong, correct?
Yes, yes.
So Dr. Williams, if people want to find more on that GLP-1 weight loss, but also the aesthetics to kind of help combat those effective outcomes, where can they go to find more information?
First, you have to follow our Instagram. We post a lot of procedure videos and also before and after. Ali'i Nani MD. You can also follow my own Instagram, HawaiiBeauty_injector. And you can also go to our website, ali'inani.com, or call us 808-693-9930.
Thank you, doctors, so much for coming in. We also saw that discount too. Make sure you mention Hi Now Daily and talk about that special discount. We'll see more of you folks in a little bit, but for right now, we're going to go to a quick break. You're watching Hi Now Daily. That's a good one, 10%.